aesthetic, cosmetic, and general dermatology meetings of the year. And I'm really just surrounded by my esteemed colleagues. So it's really such an honor to be up here among them. So I've got a great talk today. My talk is a very hot topic, and it's about what's going on when it comes to men and aesthetics. So here we go, rapid fire. So these are my affiliations. I don't believe that they present any conflicts during this talk. The male demographic is on the rise. So we are seeing more and more men coming into our practice doors. Cosmetic procedures performed on men has increased by 273% since 1997. Now the two hottest procedures, neuromodulators and dermal fillers. Now last year, over 10% of all elective aesthetic procedures were performed on men. Now in the workplace, youthful looks are really more important than ever. In the past, it was all about experience and seniority. But now certain industries actually favor youth over experience. So they sort of equate aging with mental stagnation. If you look tired, if you look old, your ideas are perceived as tired and old. In fact, in one study, workers with below average looks actually earned a 5 to 10% lower salary than their peers. Now, when it comes to men and aesthetics, attraction breeds success. So if you're more attractive as a man, you're more likely to earn more money, and you're more likely to secure positions of power. So attractive West Point grads actually achieve higher military ranks. We know that our pharma reps are strangely good looking. Well, attractive pharmaceutical reps actually close more sales than their unattractive peers do. Attractive quarterbacks earn higher incomes. You know that politicians are much more likely to be elected if they're considered attractive. So what is it that when you look at the facial anatomy, there are subtle differences that we just instinctively look at a face and we're like, oh, that's attractive. But it's so different between a female and a male. And if you're going to approach a male patient and start to intervene in a cosmetic way, you better appreciate some of those subtle differences because you don't want to feminize the male face. So compared to women, men tend to have a squarer face. They have a more angled and pronounced jaw. They have equally balanced upper and lower facial proportions. They have a bigger forehead. The forehead height and the width are both greater. They have supraorbital bossing and they're flatter eyebrows. The eyebrows actually are flat and they sit lower along the orbital rim. Other things to keep in mind when it comes to male facial anatomy is that men tend to have increased facial muscle mass. So the androgens, the testosterone, actually causes muscle hypertrophy. What does that mean clinically? It means you have to use a lot more neuromodulator to see an effect. I have so many men who come to my office that, oh yeah, Botox, Dysport, Xeomin doesn't work in me. I tried it twice already. And then I'll use the doses that I know I'm supposed to be using and they get a great effect. Clearly they were undertreated. So it's very important to keep in mind. Also, men tend to have a greater density of blood vessels. So there are actually Doppler studies showing that under the surface of the skin, there's actually a more complex, a richer microvascular plexus under there. Why? Probably because men tend to have a lot of coarse terminal hairs on their face, and in order to sustain the growth of their hairs, they need a lot of vasculature. But what does that mean clinically? It means they're more prone to bruising. This is so important to talk about up front with your male cosmetic patient because men can't camouflage with makeup in the same way that women can. So they're at higher risk of bruising and it's harder for them to cope with that bruising as well. Men tend to have less, epidermis and dermis is thicker. What does that mean? It means that they actually are less likely to develop that creepy, fine line appearance to the skin, but they do have less subcutaneous adipose. So you do see a little bit of like dermis on dermis folding. So they do tend to get deeper wrinkles and folds, such as the nasolabial fold. And last, men have larger pores and they have more sebum. So that brings up the point that you could certainly discuss, peels in your male patients. I'm going to be demonstrating a peel live tomorrow that I use very frequently, and my male patients love it because they tend to have that greasy, acne-prone skin, and they respond very well to peels. It's also very relevant when it comes to your discussion about skincare and cosmeceuticals. The types of product that you're going to recommend for men is going to be very, very different from what you'd recommend For women, men are gonna appreciate gels, lotions. Of course, during breaks, I'm more than happy to talk to you guys about the products that I find the most successful in men. So when it comes to neuromodulator treatments, we talked about the fact that men have these larger facial muscles, right? So we need to use higher doses. Actually, many studies show, and in my practice, you need to use 2 times the dose of neuromodulator in your male patients as you do in your female patients. And that's important because A, you don't want to undertreat the patient, you want them to see an effect, but 2, it has a significant impact on budget. It's an expense. You need to talk about pricing up front with these patients. If they're going to be maintaining these results every 3 to 4 months, it is a significant contribution. Now, the corrugator supercilii, the muscle that extends over here, it actually extends more laterally in your male patients. And that's very relevant because I always have my patients animate, and then I actually mark them with a white pencil, but prior to injecting. Now, when you have them animate and you say frown as hard as you can as though you're angry, and sometimes I have to prompt them with my fingers because I occasionally get the frown with the lips, and I'm like, not what I meant. So I try to prompt them, they do that, and then you can actually see the tail of the corrugator extends much more laterally in men. If you don't address that, you're gonna get this weird pulling effect in your male patients, and they hate that. Also, a significant number of men are going to have androgenetic alopecia, and it doesn't take away from their stunning good looks, as we saw with Leon, who's very handsome. But you do have to keep in mind that you have to extend your injections. If you're treating the forehead, you have to extend it all the way up to the frontal scalp, or you're gonna get this weird sort of crease, this weird wrinkle right along the hairline that's normally camouflaged by a full head of hair. Also, this is the worst thing you can do when it comes to a neuromodulator treatment. You don't want a male to walk away with what's called the Mephisto sign. Any of you know what that is? It's that Spock or that peak, that arched brow. So we take advantage of that in a lot of women, right? Because for a woman, having that Megan Fox or Kim Kardashian arch can be very aesthetically pleasing. But if you leave a man with a peak or an arch, that's very feminizing, and he's not gonna come back. So it's very important to treat the frontalis equally, medially as well as laterally. So when it comes to fillers, these are some major considerations that I keep in mind when I'm doing fillers in my male patients. The infraorbital hollow is a major area of concern. I have so many male patients come to me and say, I just look tired. And men are prone to that. Why? Anatomically, they are prone to orbital fat herniation and loss of bone and soft tissue. In fact, men have the greatest loss of soft tissue thickness in the tear trough area. They lose about 40% of soft tissue thickness in that area, which is significantly higher than the amount of loss in the rest of the face. I also very frequently treat the jawline in men. As we discussed before, that's a very masculine feature to have that defined jawline. It also helps with draping of the neck. And the 2 products that I tend to reach to for that are HAs that have a high G prime, and I also use a lot of polylactic acid along the jawline. It's beautiful there. And last to keep in mind is that men have a flatter OG curve. So when you're treating the cheek, we talked about that flatter cheek, you don't want to give a man an upsweeping cheekbone because again, that's going to be very feminizing. So you really want to keep in mind that you want to keep that cheek flat even if you're augmenting that area. Now I have a lot of men coming to me for non-invasive body contouring, and I frequently use cryolipolysis, I'll use ultrasound, I'll use radiofrequency, but regardless of the device, what's important to keep in mind is that there's different distributions of fat in a man as compared to a woman. So in a man, the fat distribution is considered android, meaning the fat is deposited more centrally. So it's in, sort of a muffin top, and then your love handles. Whereas in women, it tends to be what's called gynoid, which is distributed in more of a pear-like fashion in the buttock, the thigh. Now, what's considered an ideal male physique is what's called the Adonis ratio. So I don't know if you guys have heard of the golden ratio, but there's this concept of the ratio of 1 to 1.618. And there's certain features, the upper lip to the lower lip, the shoulders to the waist. If you adhere to that proportion, it's perceived by the eye as being beautiful, aesthetically pleasing. So we actually use the golden ratio, and we change the name a little bit when it comes to the male physique to the Adonis ratio, which I actually love. And what that refers to is the ideal shoulder to waist ratio in a man, and that's 1.618 to 1. So of course, it's the man's responsibility to build this up, right? To build up the pecs and the deltoids, muscle resistance training, weight training. But what we can do is we can help that V shape along by targeting the muffin top and the love handles using these different non-invasive body contouring techniques that we now have available to us. So I'm seeing a lot of men presenting to my office for that. And then last but not least, I'm sure we're going to be tackling this over this weekend, an area that has been really exciting over the last year is the treatment of submental fat. So it's that pocket of fat right underneath the chin. And in men, they particularly hate that. Yes, it makes them look overweight, it makes them look older, but it can be physically uncomfortable for men. I have so many male patients, they come to my office, they say, I'm wearing a tie and I'm buttoning up my shirt all day long and I'm physically suffocating all day long. It's actually uncomfortable. Genetically in my family, we just have thick necks. So it's cosmetic, it's also a matter of comfort, but I'm treating a lot of this area in men, and now we have two amazing technologies that really do deliver results. So we have deoxycholic acid, which is very unique in that I can hold the syringe and I can really sort of customize that treatment to meet my needs, but it's important to keep in mind that the side effects, it truly does result in swelling, and you have to talk to your male patients about that right off the bat. I say, you're gonna look like a bullfrog. You're gonna look like a bullfrog for probably about 2 weeks. And if it's less than that, then they're pleasantly surprised, but you really do need to warn them of that. We also can't really treat the more lateral aspects of the fat because we can't go too close to the marginal mandibular nerve or else you're gonna end up with a crooked smile. So those are some limitations when it comes to deoxycholic acid. Now, more recently in my practice, I've also started using cryolipolysis in this area because that company just came out with a new handpiece, a new applicator that targets the submental fat. Now, for that, it's sort of a one-size-fits-all, so you have to be able to fit into that handpiece in order to get a good seal, in order to get a good result. But I am able to tackle more lateral fat deposits because I'm not worried about hurting the nerve in that regard. And also, the downtime is a little bit less because there's less swelling. So I'm more than happy during breaks to talk to you guys about how I use both of these procedures. I actually tend to use them in combination very frequently, but sometimes I'll select one over the other. How are we on time? Do we have time for any of these audience response questions? Maybe, maybe not. Anybody give me a thumbs up? Am I under my time? I have 2 more minutes. Okay, great. So what is the golden or Adonis ratio? 1 to 2, 1 to 6.18, 1 to 1.618, or 1 to 3.14? Suspense is killing me. All right, so do we want to see the response? Are we going to bring that up? Nice. Oh, okay. So the answer is 3. You guys are all correct. So ignore the orange, because the orange makes it look like that answer is correct. All right, great. And then one last question, because we still have 1 minute left. What is the name of the acid used to dissolve submental fat? Alpha hydroxy acid, lactic acid, deoxycholic acid, or salicylic acid? All right. Excellent. You guys are all awesome. All right. Thank you so much for having me.
Got it. Okay. Okay, we're back on schedule.